Good morning, guys. So once again, Dr. Lay is here. Now, here are some of the medications that most of you abuse the side effects. Okay, so you use these drugs without knowing that you're utilizing the side effect, and you think that is what that drug is designed for. Number one is this drug that you call Piriton. Piriton is a brand name. The generic name is Chlorpheniramine. This is an antihistamine. It is designed to help you heal allergies or sometimes flu, that flu that comes with an allergy. That's why it's part of the combination of the medicines that are used for flu. But most of you call it dawa ya kulala. So you utilize it as a drug that is supposed to be used for inducing sleep. And this is for most people who abuse Mira, the cat. Most people who chew these drugs that stimulate your CNS, and then the following day you are unable to sleep. So you think that this drug is going to change that, going to undo what you did by just giving you sleep. You're actually abusing an antihistamine, and you're getting the side effects, which is drowsiness and sleepiness. So you start sleeping because you've abused an antihistamine. Number two, another drug that is actually being abused by the same group of people, thinking that is a drug that is supposed to be for inducing sleep. This is a drug that has been utilized for depression. And when I say depression, I talk about depression as a disease that is actually is a made-up disease, if you know what I mean. Clinical depression doesn't exist. But this drug is indicated for clinical depression. It's called Amitriptyline. This drug was designed for depression, and people utilize it to get sleep after an episode of possibly drinking alcohol or chewing Mira. So this drug is not for sleeping. This drug is an antidepressant. Again, for those people who urinate in bed at night, this drug can be utilized in both children and also adults who experience nocturnal enuresis. That basically means you wet your bed. So because of its side effect, which is urinary retention, it retains urine in the bladder. That means you'll have a night without having to worry about urinating in that bed. Number three is, of course, the one and only, the blue pill. We call it Sildenafil. Now, Sildenafil, most of you know it as Viagra, using the brand name. This is a drug, or Kifaru, or whichever drug name that you use, but the generic name is Sildenafil. This is a drug that was designed for pulmonary hypertension. So it was designed for people who have hypertension, pulmonary hypertension to be specific. It is still being utilized as a drug for pulmonary hypertension. But nowadays, the side effect is abused, and the side effect is vessel dilation, which causes an erection. Also, the side effects of this drug is the same dilation. Actually, that's not a side effect. That's actually its mode of action. It dilates blood vessels, and then your blood pressure goes down. So when it dilates blood vessels in your penis, blood gauges in the penis, and you get an erection. And it's also used by these people who are in the gym. You see them taking these drugs to just dilate their blood vessels so that they can improve blood flow towards the vessels. They're actually capitalizing on a drug that is designed for hypertension. Therefore, if you take it when your blood pressures are normal, that means you'll go into hypotension. That's the reason why most men die in service. Okay? And the last drug on this group is actually what we call dexamethasone. This is a steroid drug. It's intended for people who have asthma, people who have allergies and all this. And it's a steroid drug. But the most worrying thing is that ladies are using it to actually broaden their hips and become fat. So most ladies are thinking that the bigger you are, the better it is, the better the attention that you'll get from men. Ladies, that is not true. So as you grow fat, men are now running away from fat women because of the emotional burden and the health costs that are coming with a fat woman. So don't utilize a steroid drug side effects to get fat. What you're doing is you're actually causing a problem with the kidneys, and therefore you start retaining water, because that's what steroids do. They cause water retention. They cause an even deposition of fat on your shoulders, on your hips, and all that. So that is a side effect. But most importantly, these drugs will also cause very weak bone. So you can imagine putting up mass, but you cannot handle that mass. You cannot carry that weight, because these drugs are causing very weak bones, osteomalacia and osteoporosis. So as much as you're taking them, and nowadays they are even in most combinations of appetite drugs, because women have decided to just go that direction. It is a bad direction. Please do not utilize steroids for weight gain. Okay, this is also for the gym bimbos. Don't go there taking steroids. You're just utilizing water retention, which is basically affecting your kidneys. You're going to destroy your bones, so the strength of even lifting will be a problem. So take a lot of cautions when you're taking these drugs. Understand that you're utilizing the side effects and not the actual effects of those drugs. But remember this, every drug comes with side effects. No single drug has no side effects. All of them come with side effects. And therefore it's only safe that if you're building mass, build it the right way. Eat healthy, eat clean, start fasting, and most importantly, rest. Thank me later.